So when people come back, they're just really happy that their life didn't stop from a work standpoint, social standpoint. We have spouses pick up their husbands, and they're kind of peering into the door thinking they're going to see a freak show, and they're like, oh my gosh, this is nothing. It's a great feeling.
That's the voice of Daniel A. Danyo, MD, founder and physician at North Atlanta Hair Restoration, a boutique medical practice solely dedicated to the diagnosis and treatment of male and female hair loss. You're listening to Hair Restoration with Dr. Daniel A. Danyo. I'm your host, Clark Buckner, and all season long, we'll speak with Dr. Danyo about how he and his team at North Atlanta Hair Restoration are helping his patients transform their everyday lives for the better. In this episode, we'll dive into shaveless FUE, the procedure that's made Dr. Danyo's practice an international destination for people looking for discreet hair restoration that won't interrupt their lives. Dr. Danyo explains why he's made this skill-intensive procedure his specialty and shares why his patients are thrilled with the results. Now, let's jump in. Dr. Danyo, I am so excited to be talking with you again. How are you doing?
I'm doing great, Clark. How about you?
Great. Doing wonderful. And I love these types of shows where we can really do a deep dive into a topic of interest. And, I know this is we're sort of in early episodes for this show, and we're going to be talking about a topic that you get a lot of questions about. And so, more or less, we're going to be talking about what is shaveless FUE. What is shaveless FUE? So I really want to understand the history, the background, the context, just to understand really what this is all about, what it is. Then we're going to talk a little about how it works, and then really, ultimately, the why behind it. Why shaveless FUE? And so I just want to dive straight in and learn what is FUE? What is shaveless FUE? Can you kind of give me an overview?
Absolutely. So, this is something that I'm passionate about, and shaveless FUE is a procedure for a hair transplantation that, I do probably 80% of the time, and people are searching me out in the U.S., across the U.S., even out of this country. So I think before we kind of delve into what is a shaveless FUE, let's kind of go back into the history of hair transplant just a little bit.
Yes.
And then I'll pull it all together. So, hair transplant actually started in Japan. It was kind of pre-World War II. And there's a physician there who started doing literally FUE, or taking individual grafts. And what he did was kind of lost during the war. And it really wasn't until kind of the late 60s, early 70s where, the traditional plugs came to be, where you were taking full thickness skin grafts and then moving that into the front of the head, with the unfortunate side effect of having a look that was pretty unnatural.
Certainly. And that really has that early. I remember we talked about this last episode. You were talking about how that sort of created a pretty bad perception that has remained in some ways.
Oh, absolutely. So it kind of had that doll's hair look, and people would look at it and almost kind of bite their fingers to say, "Oh my gosh, I can't believe he or she just did this." But luckily, those days are gone. And then it kind of moved from that to more of traditional strip, or FUT, that's follicular unit transplant harvesting, where a strip of hair-bearing scalp is removed from the back of the head. And then typically technicians then will sliver and actually obtain individual hair grafts from that strip. As time kind of progressed, those linear scars that were produced from the strip were just really becoming a bummer for people. Many of the patients had no detectable scar, but many had pretty wide or thickened scars, or had significant pain. And kind of in an attempt to get away from the scar. That's where FUE, or follicular unit excision, it used to be called a follicular unit extraction. That's where that kind of came to be, where you take random hairs directly from the scalp instead of pulling a strip and leaving a linear scar, and then getting single units from the actual strip scar. I hope that all makes sense to you, Clark.
Yeah, it's a lot. It's Do you normally find people when they're exploring this, are they how often are they referring back to the old days? Is that a common fear?
Well, I mean, first they don't want, like a pluggy look, and if you're doing single um, follicular, placement, and that can be anywhere from like 1 to 4 hairs, but in creating natural hairlines, especially with using single hairs, I mean, you're not going to get a pluggy look. It's going to look natural. But really, FUE, or follicular unit excision, came out to get those single units, but do it in a way that you did not have a linear scar. Um, so, traditional FUE actually requires the hair that you extract to be short. So, the easiest way is to literally just shave the head. And I would say the majority of FUE done in this country, and really around the world, is done with either part of the scalp shaved or the entire head shaved. And that's just not something that most kind of
No,
working,
right,
people or social people can do easily, unless they have like 2 or 4 weeks to take off. And
right.
that's how kind of this kind of shaveless, also called non-shaven or unshaven approach to FUE, then came to life.
Wow. And you become globally sought out for this.
Yeah, so shaveless, or unshaven or non-shaven FUE is really hard to do. And first off, I mean, FUE in general is extremely hard to do, and there are so many variables in hair type, skin type, so each case is different. And when you're oftentimes extracting 1,500, 2,000, 2,500, even 3,000 follicles, and trying to get close to 100% success rate on each follicle, it takes a lot of skill to do it, and it takes a lot of patience. And then when you throw in long hair around where you're actually extracting the grafts, um, it's kind of like going on a long drive in the snow. You're going to get
Mm,
there. It takes a little bit
take your
longer,
time.
um, but it takes a lot of practice to actually drive well in the snow. I know that firsthand because I'm a northerner in the South. So
Right. You don't get much snow in
yeah,
North
people
Atlanta.
can't drive in the snow down here. No question about it.
You get that eighth an inch, and it's going to shut down the city.
Yes. So, why would somebody, want to kind of search me out or want a shaveless FUE? And the reason is concealment. People do not want anyone to know that they've had a hair transplant procedure done. They obviously don't want to have a strange haircut, especially for women. They don't want any part of their head shaved, even if you shave out a little box. Um, and It really opens up the possibilities for people to do hair transplant when the other barriers, like the linear scar, the plugginess, and then the shaved head or weird haircut, are now eliminated. It opens the door. And that's kind of where the popularity has been. So really they're searching me out because, I do this 80% of the time in my practice. I mean, that's what I'm known for, which means we are practicing almost on a daily basis to deliver high quality graphs at high numbers, and doing an excellent job concealing the donor site and the fact that a procedure was done. Um, and I, as a physician, I think we talked about it in the first podcast.
Hmm.
I do the bulk of the work. I do all of the extractions as far as coring the grafts with a mechanical device. I do all the nerve blocks and anesthesia, and I actually place all the hairs. And that's just another, reason um, for somebody to choose me, along with the shaveless FUE.
And that's not the most common way. I mean, a lot of times you'll meet the doctor and you'll kind of get passed along from person to person. And I remember, yes, in our kickoff episode, we were focused so much on just the passion that you have, your background, but also the relationship that is important to form. And you really go from start to finish.
Y- Yeah, well, I treat my patients, like I would want to be treated, and they're not. It's not a sales job for me, and kind of being invested in the patient, and then kind of investing my time and extra energy to do a shaveless procedure, especially when they're above 2,000 or 2,500 grafts. A lot of people have told me that, well, you can't do that many shaveless in a day. Well, and it's something that we do frequently. And the fact is, I'm totally invested. I have over years practiced the art of doing this procedure to where I'm able to block out the other hairs or distortions of the view because of bleeding that you can't really see with extra hair around, or um, you know um, kind of different angles. I've been able to do this successfully just based on my passion and really just based on practice. Um, and the fact that it's not being done universally is because of the extreme difficulty with actually doing it.
I'm curious about this. So, how do you get started doing this? I know but hear what you're saying. It's really challenging. It sounds really complicated.
Yeah.
How how do
Well,
you
I
get
went to
started?
it was about 6 years ago. I went to a course, and I was sitting listening to a lecture where somebody was talking about and showing pictures of a unshaven, or shaveless FUE. And he said this is extremely hard to do. We're only doing 500 grafts at a time, and it's taking us a long time to do 500 grafts. We're just kind of doing it for smaller cases, and not definitely not for bigger cases. And this is something that you can shoot for, but keep in mind it's extremely hard. So I had two hair transplant procedures and had my head shaved both times, and for me it was just a royal bummer. I mean, just I
Sure.
felt isolated. I didn't like having my head shaved. I didn't really want to go to school events for my kids, or kind of go out. We're pretty social. So I felt isolated for about 3 to 4 weeks. And I just imagined what my patients would go through. And not to mention, I had multiple patients that said, well, I can't have my head shaved. So I can't do it. Um, so I saw a real need after that lecture to say, you know what? I'm going to get good at this. I'm going to practice it. And, I started doing my first case, I think, was 200 grafts. It took me probably 6 hours to
Mm.
do. Um, and then we went up to 500, and then we went up to 1,000. And I've actually done 3,100 shaveless in a day. And
Whoa.
um, it was not a very, drawn out affair. I mean, we've gotten so fast at it that we can now do shaveless procedures faster than most people can do shaved procedures. And again, it's a practice thing. I am trained. My staff is trained as well, as far as cleaning, as far as creating spaces, pulling grafts that I've cored. It's really an orchestra that takes place when we're extracting and doing a shaveless procedure. So everybody in the team has to be on board. You have to develop the eyes and the skills to do it.
Well, so you were sitting there, you hear the you know the experts say, you really can't do this more than 500, and you just challenge accepted.
Yeah, and even a recent course that I went to, somebody was talking about shaveless and said, "We limit it to 1,500 grafts in a day. That's as much as we can do." Um, so, you know, I, I I just feel because we've made it a priority and made something that's deemed a big deal and kind of marginalize that uh, in our minds to where this is routine. It's not a big deal, and so we can get pretty large cases done, even 2,500 grafts in a very reasonable time, usually about the time of a workday, instead of like 11, 12, 13 hours that people report, having to do from a time standpoint because it's a lot more laborious.
Certainly. Is there anything else that we've not talked about that
Yeah,
explains
well,
how it works?
yeah. So the shaveless FUE really it just has a lot of advantages. For one, let's say you're like a high level guy, maybe CEO of a company. You're out in the public eye, and you need you know 2,000, 2,500 graphs to fill in, but you really
And
don't want any
is that like
more.
is that how many grafts does just if you didn't need a procedure, how many grafts like would you normally have? Does that make sense?
Oh, in your
The
head.
whole head.
Well, I mean, where we pull grafts from are from the side and back of the head. So there are probably, 8 to 10,000,
Okay.
grafts, maybe up to 12,000. So you can actually take up to 50% of those hairs if
What?
done properly before there's thinning in the back.
And so you're
Um,
taking that like almost like a pour out? Is it like a pour?
yes, yes, you have a round kind of punch that we use a round oscillating trumpeted punch that basically scores the whole follicle, and then we manually pull the grafts.
Whoa.
So it's a tedious process.
Right. I mean, you're doing that pour by pour, or
Yeah,
graph by graph,
graph by
and that's by
graph. So
hand. It's a wow.
if you let's say that you were doing 2,000 grafts and you added a second, for each 2,000 graft just on the extraction side, you're talking about an extra half hour, about
Mm,
2,000 seconds. Um, And so, there's got to be momentum as you're doing. And velocity. You have to keep moving. So you have to do the proper things to keep the vision intact. Um, you know, um, while you're still getting graphs, and my assistants are behind me pulling the graphs. I mean, we have to work with sometimes really long hair. Sometimes it's shorter, but um, like I said, it's an orchestra. But the nice thing about shaveless is I can do whatever number of grafts you want at one time because you don't have to have a weird haircut. Typically, if you shave your head, you're like, all right, just do as much as you can, you know.
right.
Um, but it gives people the option. Like this morning, I did a shaveless eyebrow case of 300 grafts. And she walked out. Obviously, you could see the grafts in her eyebrows, but her hair in the back, uh, there were no short hairs left. We didn't shave any part of the scalp. She's going to have a normal, existence as far as the back of her head goes, and that's very satisfying for people. But back to that CEO that's in the public eye.
Right.
I mean, you could do 500 grafts at a time, and just kind of slowly build it up. And we did that for somebody, and he was just totally happy. The other thing is we see a lot of people that have had prior strip procedures in scars in the back of the head that they don't want unearthed by shaving their head, and we're able to do you know FUE, a shaveless FUE around the scars and conceal them with the existing hair, and that's a huge advantage.
Wow. Well, we've been talking a little about what it is, how it works. We've been certainly talking about the why behind it. Are there any other things that either have surprised you or maybe surprised some of the clients you've worked with about this? Things that you've learned over the years from this? Any other things on your mind?
Well, I think the biggest thing is that when people leave the office, because most of my patients are not like fully bald. I mean, people have hair loss, but most of the patients that I see, I'd say 70% of the male patients have existing hair that so they can cover where we've actually grafted. So when you leave, and again, this can be a pretty large procedure, and your donor site shows no evidence that you did any procedure, um, and then you can take the existing hair and kind of place over because we don't need anybody to cut their hair up top, and kind of cover the grafts that we placed. They walk out of here and they can actually go out to eat, and nobody would know that they just had 2,000 grafts.
Right then
And
and there.
what's
Right,
that?
like you're saying, that's you have the procedure and then you go out to dinner.
Yeah, absolutely. Or I've had people even go to work the next day. I mean, the worst thing is I've had people say, "Well, I had this procedure done before, and I'm just going to take 2 weeks off." And it's like,
Whoa,
that's
no, you
ridiculous.
don't need
I
to do
mean,
that.
our most frequent day is Thursday because we do it on
Mm,
Thursday. They got Friday, Saturday, Sunday, go back to work Monday.
they're rocking and rolling.
Yeah, and part of and I call it the art of concealment, is not only the shaveless FUE, but you have to put in the right amount of medicine and do the nerve blocks correctly. We use pen implanters instead of doing surgical slits with hand placement, so that we have very clean grafting and really minimize any swelling in the face. So it is extremely rare that my patients have even a little bit of swelling in the face, let alone being almost debilitated from severe facial swelling, which often happens after hair transplant. So the combination of concealing the donor site, the graft area, the use of implanter pens, minimizing the medications, doing effective nerve blocks, and then having somebody without facial swelling is like, those are all huge things. So when people come back, they're just really happy that their life
That's
didn't stop
awesome.
from a work standpoint, social standpoint. We have spouses pick up their husbands, and they're kind of peering into the door thinking they're going to see a freak show, and they're like, oh my gosh, this is nothing.
Yeah, that's
It's a
got to be the
great
best
feeling.
feeling. I know that is so part of your heart and passion on this is seeing the loved ones and how they respond. I love it.
Yeah, yeah. So in it and my patients appreciate the extra work that we put in. We always hear it. I just said, you guys hit it out of the park. When I give them the mirror, they are actually, they thought that their hair in the back would look extremely thin, and there'd still be evidence. They're shocked when their donor site is concealed. And I would say the majority is, sometimes if the hair's too short or really thin, it may be a little noticeable, but not majorly so.
That's great. I love it.
Yeah.
It's good,
So it's all
good
good stuff.
stuff. So I've really enjoyed hearing just a little more behind the scenes on what goes into this. I know there's a lot more, of course, deeper on, really in the weeds on how you do the work, actually do the procedure, but it all makes sense on the high level view, what it is, how it works, of course, the why behind it. And this has been really insightful. Any final
Yeah.
thoughts you want to leave us with?
Well, I think, if you're a physician listening to this, and you're getting into hair transplant, or you've been doing it and you're trying to get into doing a shaveless procedure, I mean, there are certain steps that you need to do. For one, maybe have part of the case be shaveless, especially in the beginning, and start out with even 100 or 200 grafts. You need to learn to use high powered loop magnification. I actually use 5.0, which is very magnified, and there's no way you can do this with just kind of jeweler magnification at 2.5 magnification. It needs to be 5 to 6 times
Wow.
mag to really do this correctly. The problem is your visual field goes down with the higher magnification, but it's something you've got to get used to in order to do
Can't
it.
imagine.
Yeah.
You're good at what you do. Well, thank you again for taking the time to share a little about your work. I can't wait for our next conversation soon.
Sounds great, Clark. Thank you.
Thanks for listening to Hair Restoration with Dr. Daniel A. Danyo. You can book your free consultation today with Dr. Danyo by simply calling 678-845-7521 or online at nahairrestoration.com. And be sure to subscribe, rate, and review this podcast wherever you listen to your audio content.